Good morning. My name is Tiffany Frederick, and my presentation is on multiple sclerosis in my adapted physical education and sports class with Dr. Kaiser. What is multiple sclerosis? Multiple sclerosis, or MS, is an autoimmune condition. The body's immune system, which is supposed to protect us from infection, decides to attack the brain, spinal cord, and optic nerve. It is unpredictable and it disrupts the flow of information within the brain and between the brain and body. Our myelin sheath, which is connected to our white matter, is destroyed, which our white matter sends information to our gray matter, which the gray matter allows us to transfer information from the brain to the body. Our next slide is a slide which shows us a little bit further of our gray and white area of the brain. I hope that video gave you a better understanding of our gray and white area of the brain and how important it is and how MS attacks those portions of the brain. MS is very common in the United States. 1 out of 750 adults are diagnosed in the United States. 1 out of 40 young adults are diagnosed each year. The average age is about 30 years old, and women are 3 times more likely to be affected than men. Diagnosing MS has become more clear by symptoms related to vision, such as eye pain and blurred vision. 80% of early diagnosis is associated with fatigue symptoms and eye pain. Common physical symptoms of MS are fatigue, tingling, and numbness in hands, feet, and legs, blurred visions, temporary blindness, eye pain, and these usually last for about 24 hours, sometimes a month, several months, but the typical length of symptoms is about 24 hours. Less common symptoms are the most dangerous: seizures, difficulty swallowing, and breathing. If you do have these symptoms, you need to consult a doctor quickly. Common cognitive symptoms of MS: trouble thinking, difficulty concentrating, memory loss, which affects the ability to learn and remember information. Treatment methods of MS: there are 4. Oral medication is given daily and less expensive. Injections are given in the early and active ongoing stages of MS. Infusions are given throughout the relapse stage to help the body through remission. Physical therapy is also a treatment which strengthens muscles and help decrease inflammation from the brain. Physical therapy is very, very important physiologically and psychologically, because some days for an MS patient not to be able to move or perform his daily activities can tap into that psychological part of our brain, which leads to depression, and it really affects our physical as well. Teaching students with MS, moderate and daily activity is very, very important. Very short intervals of time, which is 30 minutes a day. Pool exercises are highly recommended, which helps with balance and has less stress on our muscles. When working in the pool, just make sure that the degree is lower than at least at 80 or below, because MS patients are heat intolerant and don't like a lot of heat. Positive attitudes affect students' outcomes. Teachers should have a very positive attitude in helping MS patients, giving a little life into the students, being very enthused about getting them stronger, creating more flexibility, balance, agility, all those health-related skills that can just increase the daily improvement of an MS patient. Exercise and helping a student with MS. Again, as mentioned before, strength training with light weights, balance, which is the pool is great for that, flexing, stretching, flexibility, activities that can be performed to help increase some of your flexibility is yoga. Chair exercises gives us those non-weight bearing, but we can still work on leg strength, also flexibility and moving our legs, arms without a lot of weight. Arm lifts with light weight. Other activities that can be performed is bowling, table tennis, non-contact sports. It is not good for MS patients to participate in basketball, football, anything that's going to create that contact. This concludes my presentation, and I hope you all enjoyed. Thank you so much. Have a great day.